Most people believe that arthritis pain comes from damaged cartilage, but cartilage has no nerves at all. In this video, I will explain where arthritis pain actually comes from and how a biologic approach called the PRASAD protocol attempts to address it. In our culture, the word PRASAD holds a sacred meaning. It is an offering, a divine gift received with grace. Recently, a patient called my clinic and asked to meet Dr. Prasad. I smiled and explained that I am Dr. Venkatachalam. Prasad is not a person, it is a philosophy of healing. I chose this name because the greatest gift for rejuvenation is not found in a pharmacy or in a metal implant. It is already inside you. It is a biological gift from your own body back to your own body. But before we go further, let me share a critical insight. The cartilage in your knee, the part everyone blames for arthritis pain, has no nerves at all. It cannot produce pain. The deep aching pain of arthritis often comes from the bone beneath the cartilage. Modern MRI studies often show this as bone marrow edema, a sign of biological stress inside this bone. That single insight changes how we think about arthritis treatment. Most arthritis treatments focus only on the cartilage surface, but osteoarthritis is not a cartilage disease. It is a whole joint biological process. It involves inflammation, destructive enzymes, disturbances in cellular signaling, and biological stress in the bone beneath the cartilage. If we treat only one layer of this disease, the results are often incomplete. That is why the PRASAD protocol was developed. When people hear the words biologic treatment, they usually imagine an injection that temporarily reduces pain. PRASAD is different. It works on four major biological processes that drive osteoarthritis. First, inflammation. This is the chemical irritation inside the joint that causes swelling, stiffness, and night pain. PRASAD helps reduce inflammatory signals such as IL-1 and TNF-alpha. Second, cartilage breakdown. Inside an arthritic joint, certain enzymes gradually degrade cartilage. These enzymes are known as MMPs and ADAMTs. PRASAD helps reduce their activity. Third, healing signals inside the joint. Cells communicate using biological signals such as TGF-beta, PDGF, and VEGF. PRASAD enhances these helpful signals to support a healthier joint environment. Fourth, the bone beneath the cartilage. Modern research shows that the subchondral bone often generates much of the deep aching pain of arthritis. When necessary, the PRASAD protocol can address this bone compartment using marrow-derived biologic signaling. Scientifically, PRASAD stands for Platelet-Rich Adipose Stromal Advanced Derivative. PRASAD does not introduce a new biologic substance. It represents a structured way of combining and applying biologic signals based on joint biology. In simple terms, PRASAD uses signals from your own body to help restore a healthier biological environment inside the knee joint. It is not simply an injection. It is a comprehensive biologic intervention. The PRASAD protocol is guided by three principles. First, biological sufficiency. The treatment must deliver enough biologic signal to influence the joint environment. Second, compartment targeting. Osteoarthritis affects multiple parts of the joint: the synovium, the cartilage, and the bone beneath it. Treatment must address the correct compartment. Third, phenotype matching. Not all arthritis behaves the same. Inflammatory arthritis, bone-driven arthritis, and metabolic arthritis require different strategies. PRASAD attempts to match the biologic intervention to the biological behavior of the disease. In 2026, international knee experts from ESCA released the Orbit update. They recognize that stromal enhanced and cell-based biologics may play a role in joint preservation strategies for osteoarthritis. In other words, the global conversation is gradually shifting from simply replacing joints to also exploring ways of modulating joint biology. The first principle of PRASAD is precision dosing. Many biologic injections contain inconsistent or insufficient signaling strength. Through my clinical observations, I established a therapeutic benchmark, 10 billion platelets per treatment. To achieve this, the PRASAD protocol processes 180 ml of whole blood. Using advanced robotic technology, we concentrate these healing signals into a precise super dose, delivering 3 to 5 times the signaling strength of a conventional treatment. The second principle is addressing the bone compartment. Research by Philip Hernigue and others has shown that the subchondral bone often plays a central role in osteoarthritis pain. When MRI reveals bone marrow edema, it indicates biological stress inside this bone. In such cases, the PRASAD protocol allows us to deliver biologic signaling directly to this region, something a routine intra-articular injection cannot achieve. Biologic therapies are not a universal solution for osteoarthritis. Their effectiveness depends on patient selection, joint alignment, and the biological behavior of the disease. PRASAD works best for patients with chemical inflammatory osteoarthritis, bone-driven osteoarthritis with deep ache, mixed phenotype osteoarthritis, and early postmenopausal joint degeneration. However, it is not ideal for severely collapsed joints, major malalignment, advanced bone-on-bone arthritis, uncontrolled metabolic syndrome, or systemic inflammatory arthritis. Precision medicine means choosing wisely. Before we conclude, let us summarize the key ideas. First, osteoarthritis is not only a cartilage disease. It is a whole joint biological process. Second, cartilage itself has no nerves. Much of the deep aching pain of arthritis often arises from the bone beneath the cartilage. Third, biologic treatments attempt to modulate the joint environment rather than simply suppress symptoms. The PRASAD protocol represents a structured way of applying biologic signals to influence inflammation, tissue signaling, and when necessary, the bone compartment of the joint. In simple terms, PRASAD is not about replacing the joint, it is about restoring the biology of the joint. The goal is to deliver a signal so strong, so precise, and so biologically appropriate that we aim for meaningful improvement in a single sitting. Our goal is to help reset the biological clock of the joint, not create treatment dependency. I am Dr.A.K. Venkatachalam. At the Madras Joint Rejuvenation Centre, our approach follows a simple principle: education first, biology next, intervention last. If you're ready to harness the biological gift already within you, visit my website or message me on Arthritis. We will determine if the PRASAD protocol is the right path for you. And before you go, if you found this helpful, please like, share, and subscribe. Your support helps us bring science-based, culturally rooted medical education to many more people across India. Thank you. I am Dr. A.K. Venkatachalam.